where you should be mentally is it's kind of looking at a keyboard now and you're going, okay, look at the core systems. Remember, we talked about the core systems that you should have in place, and you got to evaluate them and go, okay, where am I at? Does something need to be beefed up? Or are we looking pretty good? And in your mind, I always go, think of it on a scale of 0 to 10. And each system needs to at least be an 8 or better. If it's not, then it needs work. So again, you go to the core systems, answering the phone. What's the most important part about answering the phone? Obstacles, especially time or money. Next, scheduling the patients. How, in other words, are your staff black belts? Answering the phone, are they black belts in scheduling patients? And then you go, each unique visit, day 1 through 10. Have you went through with all your staff what should happen at each visit at each station?
They have, however, they're not black belts. They're not
Okay,
black.
well then you need to keep going through it, and
Yeah,
they need
yeah,
to write it
practice.
down. They got to remember. You got to role
Yep,
play it. Okay,
right, right.
remember to front in the front desk day 1. What should you be saying and doing?
Yeah, yeah,
When they leave day 1, what should you be saying and doing?
yeah. Day
With
one
with
through
an
five, I totally.
emphasis with an emphasis on time and money.
Okay,
You
emphasis on.
always know that's where the problems are going to be.
Yep, yep.
Need time and money. Okay. Same with when they come back to the therapy. What is she saying? You should day 1. What should she be saying on day 1? When they leave, what should she be saying?
Okay.
Day 2. See how that works?
Mhm.
So, that's just role play through those.
Okay,
Because remember, everybody's cross trained.
that's right.
They're not responsible for everything, but they're cross trained.
And I just got a backup trained for if one of them goes down. One,
Okay. A
I
part-time
just got
person?
that. I would like one more.
Is it a part-time person or what is it?
It's actually it's my therapist, the therapy's mom. She's retired. Same personality, same, real good, energetic, mentally
She
there.
can come in and help out in a pinch.
She can help out in a pinch.
Okay, good. Okay, so getting back to these core systems.
Yep, yep.
So we said answering the phone, scheduling payments, collecting money,
Uh-huh. Oh, yep, okay.
the different types of money. Remember, there's about 5 categories of money: cash, Medicare, Medicaid, major medical, personal injury, workers' compensation. So say they should know how to talk money with each one of those categories, especially on the money days 1, 2, 3, and 4.
Mhm.
So you should be role playing like a patient. Okay, I'm a cash patient. I'm coming up the front.
Okay.
I'm at the end of day 1. What are you going to say to me? That's how the role playing would sound.
Okay.
Okay. Now I'm a personal injury patient. I'm on day 2. I'm coming to the front. What are you going to say to me? And specifically paying attention to time and money. Time meaning scheduling,
Right, right, right.
scheduling, time and money. So all of 5 of those categories, 6 of those categories should be addressed on all the, especially the money days. And each person should know it. Your therapist should know the basics of the front desk. Your front desk should know how to put people on therapy, right?
Yep, yep.
Everybody's cross-trained. Okay. And then you go, so you got the routine visits. You've got the intake forms, the basic intake forms. They should all
Yep,
know
yep.
that. The difference with work comp and PI, answering your phone, scheduling appointments, therapies. So you're like, that's the core, right?
That's the core. Yep.
Answering the phone, moving patients through, collecting different types of money, what to say at each station.
Okay.
You go, okay, where am I with those systems? That's how you got to kind of step back and go, you know, Well, and one of the ways that actually you can tell if things are going well or not is you should not even have to talk to your staff members when you're seeing patient when there's a rush of patients in the early morning and late afternoon.
Yes. Yeah.
If you have to stop
Uh-huh.
regularly, like they have to stop you and ask you a question,
Uh-huh.
or you have to stop them to get some information,
Yeah.
you got to realize that's a screw up.
Okay. I got you. That's a screw.
That's because there's a system not in place.
Okay.
Because everything should just move from station to station efficiently with nobody having to communicate with each other.
Okay.
Okay, so that's how you have to look at it. You go, and I call it the machine, right?
I like it.
That's
Yeah.
the machine. That's the Henry Ford machine.
Yeah.
Okay. And then of course we want to make sure you got the layout, you got the tables and the efficiency. And of course the adjusting, you got your hot seats out there. So that creates a lot of potential business as you're seeing with nobody waiting.
Nobody waiting.
You got all your therapy stations, you've got your adjusting areas, and you have your hot seats. I mean, you can see a lot of people if you're doing your 3 to 5 minute adjustment, knowing how to control them and lead them and move them and all that kind of stuff. Okay. So you go, okay, everything's in place. I got the layout, I got the equipment, got the staff, got the training. Okay. The next one is, so you got your machine in place, then you go, okay, where's my marketing now? Now, one of the things you need to consider, remember the rule, you have to have a vacuum to grow.
Correct.
Okay, you won't have a vacuum at 200 visits a week. So remember, when you hit your high RPMs, you got to shift gears. Shift gears means you got to change a system.
That's right.
Space, labor, what are the systems? Space, labor, equipment, knowledge, skill, HR systems, motivation. Those are the systems. So when you're up at 200 visits a week by yourself, you got your front desk person, you got your back desk person, so you'd be able to, you're pretty much going to be at your high end of RPMs. In other words, you're kind of maxed out your ability of exchange of time for money.